Okay. So, hi, my name is Brad Cooper. I decided to do my PDSA project on hand hygiene in the emergency department at the hospital that I work at. So, hand hygiene is now one of the most regarded forms. So, this is the issue identification, regarded forms of infection control in the healthcare system based off scientific studies performed. 5,000 deaths occur in hospitals every year as a result of not using hand hygiene, and hospitals nationwide spend a combined of $4.5 billion as a result of not using hand hygiene. With the development of antibiotics, we have created many multi-drug resistant organisms, and the practice of hand hygiene is crucial for the prevention of cross-contamination between patients. There was also data gathered within a nursing home where that in 2000, 7.37% of citations were issued. These were nursing homes across the country were issued for not using hand hygiene, and that number has increased since then in 2009 to 11.98%. So this is increasing. They also did a study in an ICU where hand hygiene is crucial, and it showed that 78% of the nursing staff were using hand hygiene, where the bar is set at 90%. So I just wanted to see if how compliant our nurses were in the emergency department where I work, or to using hand hygiene, since this is becoming such an important issue. So this is the quality variance. I recorded 400, so the first bar here where it goes up to the 400, that's the number of times I watched nurses walk in and out of patients' rooms. The next bar down, where it's at about the 300 mark, maybe a little bit above, is the number of times hand hygiene was used entering and leaving, and then I'll show the percentages of that on the next page. Then all the way in the bottom is hand hygiene used entering only, and the next bar down is hand hygiene used leaving the room. And that's kind of in the 50s, below 50s area. And then those who did not use any hand hygiene at all. So that's how this is what this graph is. So here's the percentages. So at Scripps Encinitas Emergency Department, 90% is the standard. They want 90% of nursing staff. It should be 100%, but 90% minimum of using hand sanitation, leaving and entering the patient's room, or using soap and water when there's a no MRDO or a patient has known Clostridium difficile. So 78% 6% of the nursing staff used proper hand hygiene, meaning they used a hand sanitizer leaving and entering the room, and also what was mentioned above, where they knew the patient had an MONRDO or C. diff, and so they were washing their hands with soap and water. So it's still below the bar. A total of 21% only used it one time, and 2% of the staff did not use any hand hygiene. So we're missing it by 14%, and there is room for improvement on this. So this number here, the 35, and where the bar is there, I asked 35 nurses in the department if they knew about the hand hygiene compliance policy, knowing that it needed to be at 90% compliant, and that they needed to use hand hygiene entering and leaving the room, hand sanitizer minimal, as well as washing hands for the harsher diseases. The next line down is the number of nurses who knew the hand hygiene policy, which was between the 20 and 25 marks. So that's about 23 people knew. And then the percentage of nurses who knew the current compliance with the policy. So every month, RER posts the percentage of the staff that is actually using hand hygiene. So a little bit below 15 of those 35 nurses knew that we actually posted that in the ER. So the nurses would not use hand hygiene. So these are the as evidenced by why this isn't happening. So before I talk about this, when I would watch nurses, I noticed that they stopped using proper hand hygiene when things got really busy in the ER, and sometimes that happens. Patients are going in and out, being admitted. There's issues where things don't go as smoothly as they can, so it really kind of stresses you out. So that's when hand hygiene just becomes less of a priority. So nurses would not use hand hygiene as evidenced by increased workload in the emergency department upon observation. And then education was an issue. So there is an education deficit as evidenced by 62% of the nurses not knowing the compliance standard of the department's hand hygiene standard. They didn't know it. And then the nurses did not know the most recent percentage of the hand hygiene compliance in the department, as evidenced by 35% of the nurses not knowing this amount. Also, when asked, the number was low, 40, what was it? 35 nurses is definitely not all the nurses in the department, but it's a lot of them. So I would say for the most part, they didn't understand it. So the scope of the problem, I think there's two problems here. One is the education and the policies and procedures of hand hygiene compliance. They need to be educated more. The second is when nurses get overwhelmed with their workload, they forget to use proper hand hygiene. So the department educator, who needs to educate these people about this, needs to be involved. The manager needs to know about this to make changes. The two assistant managers need to know about this. The nurses are also stakeholders in this because they're the ones that need to make the change, but also patients. They can also remind their nurses and be encouraged to remind their nurses to ask, hey, did you wash your hands before you touched me? And they can be told that. I have no problem as a nurse being like, hey, if I didn't wash my hands, or you're worried, just remind me or tell me that I didn't do it and I will do it. I think if you have a good relationship with your patient, they trust you, they know you care about you, they know you're knowledgeable. I think it just depends on you doing that based off the relationship that you formed with your patient. So I do think patients are stakeholders in this. So here's a solution. In a study, it showed that by educating, so here's the evidence-based backing for educating and decreasing workload. So they did have staff that were 51% did not comply to hand hygiene. After educating, 85.7% of staff was more compliant to hand hygiene use. Same thing, they used 30% of the staff was not compliant to hand hygiene practices. And then after they educated, 80% was more compliant. So I really do believe that educating will work. There was also another study that verifies that when nurses are busy, hand hygiene becomes a low priority and it doesn't get implemented. So we need to find a way to lessen or lower the workload for the nurses. So when things get busy in the emergency department, a charge nurse, a float nurse, managers, they need to help. They need to come help decrease the workload. The educators also need to start educating about the risks of not using proper hand hygiene, the target compliance in using hand hygiene, and what proper hand hygiene is per the hospital policy, per the CDC, per JCAHO, all of the managing entities that help us do what we're supposed to do. So this is the solution implementation. Can't put that in the corner anymore, but we need to change the emergency department policy to include helping all nurses at all times when workload increases to float nurses, charge nurses, assistant managers, managers in their job description. They need to know that, hey, when the workload gets high, you need to start pitching in if they're not doing already. That'll go in an analysis section, but we'll get to that. The next step is the unit educator needs to provide a mandatory in-class, and I want to make sure it's not computer simulated, only because simulations you can rush through, you can go through quick, and that'll be the end of it. Sometimes nurses just want to get it done and not pay much attention to what it's doing. I know I'm a victim of that, or not really a victim, but a contributor to that. Just because they say, you got to get your education done by this day, and sometimes that day's there, and I just got to get it done just to get it done. So I think an in-class education program would be much more effective. So the education needs to include current stats about the amount of deaths that result not using hand hygiene again in hospitals. Again, it's 5,000 deaths a year and costing hospitals $4.5 billion a year across the country. And also how many deaths occur in Scripps hospitals as well as Scripps hospital's costs, which, I don't have that info for, but I'm sure somebody does. And then they need to teach the proper hand hygiene. So this is the solution implementation continued. This is actually what would be indicated. This is from the Centers of Disease Control website on proper hand hygiene. So I can go through this really quick. It's when you're using hand alcohol-based sanitizer, this is how you use it. Put it on your hands, rub, cover all surfaces, and it should take 20 seconds. They're most effective at removing germs on the hands, and non-antimicrobial soaps are the least effective. So when you wash your hands, they need to be visibly dirty. Alcohol-based is fine. You can use that if your hands aren't visibly dirty. Also, you need to use soap and water for the MRDOs and for C. diff, because alcohol doesn't kill that. So you also need to wash your hands before eating and after using the restroom. And yeah, that was already explained about, C. diff and other MRDOs to use, to not use hand sanitizer, but to use soap and water. So this is how we're going to analyze to see how this worked. We need to send out questionnaires to nursing staff to see if they received help from unit managers, or from the unit manager, from charge nurse assistant managers, and float nurses during busy times in the emergency department to see that they're not being overwhelmed. And we're going to do this within 3 months. At the same time, unit managers, charge nurses, assistant managers, float nurses need to see if they are too overwhelmed to help the nurses. It could be that, we can get the questionnaires back saying, nope, they're not helping us. But at the same time, the nurse managers could say, well, we're too busy. Our scope of practice, or what's expected of us, is way too much. We can't do it all. So that would be something to look into. The second is you need to have an exam after educating the nursing staff about proper hand hygiene, just to make sure they fully understand it. And third, after about 4 months, do another study to see if the percentage of hand hygiene is increased in the emergency department. That would just happen the same way, just by observing. Maybe we would do a lot more instances, more than 400, to make the data more valid. But if the percentage of the hand hygiene is 90% or more, then the nursing unit goal has been met. So the next step is, if the goals aren't met, we will need to we will need to continue annual trainings and compliance to hand hygiene taught. We need to make sure this education continually happens. Also need to uphold the change in policy for the nurse managers, assistant managers, charge nurses, float nurses, to help nurses so they can use hand hygiene so they're not overwhelmed. This all needs to be permanently in place if everything worked. If things don't change, we need to look at different education strategies. There's just been, too much data that shows that education works. Maybe a computer simulation is the better option. Maybe a sign-off sheet to compliance. There's other educational paths that we could explore with the emergency department educator, see what is their expertise, so we'll see what they could say. And if there isn't enough help in the emergency department from the managers, they need to hire maybe more nursing staff, or they need to find different strategies so that nurses don't get overwhelmed. I know that in RER, nurses have to do vitals, where in other ERs, techs do vitals. So that's one issue. We also draw all of our own labs for the most part. At other ERs, we didn't do that. We had lab techs do that. And to be honest, I had much more time to spend just caring for my patient instead of doing minuscule tasks that could have been done by other people. So I really do think that is an issue, but every ER has its own policies that need to be worked on. And these are my references. And that is all. Thank you. I've enjoyed this Nursing 451 class, and hope you enjoyed the presentation.